Hello and welcome to another edition of Knowledge is Power in our PDPM series. Today we're going to discuss restorative nursing. So let's quickly look at the rules and requirements that CMS has in place in order for us to capture restorative nursing on our programs. First, restorative nursing is on the MDS in Section O 0500. CMS expects that 2 programs at minimum be provided, that of those 2 programs, services are provided at minimum 15 minutes per day per program for 6 of the 7-day look-back. Allowed programs include range of motion, passive, range of motion, active, splint or brace assistance, bed mobility, transfers, walking, dressing and or grooming, eating and or swallowing, amputation and prosthetic care, and communication. Further criteria includes that patients must fall into either a behavior cognitive symptom category under Part A or reduced physical function. Patients can receive restorative services regardless of category. However, the financial reimbursement bump that a facility may see only applies to the patients falling in the behavior cognitive or reduced physical function. Although restorative nursing operates primarily the same way under PDPM as it does today under PPS, there are a few behaviors that we can modify in our day-to-day practice to be more successful. The first is to get nursing more involved. Typically, most of the restorative nursing programs established today under PPS are done by therapy, and almost always it is done at the end of therapy, not at the beginning. Let's remember that under PDPM, we are going to have to identify and establish all patient needs ahead of day 8, which means in order to capture 6 of the 7-day look-back period, in order to get the benefits of a restorative program captured on the MDS, you're going to have to start your restorative program on day 1 or day 2 of the Medicare stay. I also recommend doing a return on investment analysis. Look at your assets, look at your resources. How many of your patients that are going to get restorative actually fall into the lower 2 nursing categories under PDPM? Who is responsible for your program? The most successful restorative nursing programs almost always have a designated person, much like your MDS coordinator, who is running point, keeping everybody in line as to what is needed in order to successfully capture data for your MDS. Obviously, restorative nursing is a large topic, and almost every facility does their restorative program just a little bit differently. Please don't hesitate to contact me at lhill@therapyctr.com or at my phone number listed on this slide. I'd be happy to discuss your individual facility situation and offer advice from there. Have a great day.